Pardon?
Mother's name?
There, very good, Sarah.
Good morning.
Good morning, doctor.
Am I speaking to Sarah, mother of Sam?
Yes, doctor.
I'm Dr. Fatima, one of the doctors in this department. I'm here to discuss your concerns regarding your son. Is that okay for you?
Yeah, yes, doctor.
Yes. Ms. Sarah, could you tell me what are your main concerns?
Yes, doctor. My child's Sam, he is 5 years now.
Okay.
He is having this fits. Which I find it is increasing for the last few months. So I thought I could make you an opinion. I'm just a bit concerned about this.
Oh, I can understand this. A great concern. Sarah, could you tell me, like, have you seen he fitting?
Yes, doctor. Like he's like moving his right hands and right arm, and sometimes right legs also. The switching movement is there.
Okay.
I have seen it like it happens like it was maybe once in every week or once in 2 weeks. It happens for
Okay.
around maybe some 5 minutes or less than 5 minutes.
Okay.
It subsides like the doctor's GP told me that I should put him on the floor and make him on the sideways so that he doesn't choke anything. So I do that,
That's great.
and thank you. Yeah, I do that, and sometimes it settles on its own.
Okay.
But
That's good.
so I took the GP because he's already on this anti medicines for his fits, but still it's continuing. So I thought I have to get your
Yes,
opinion.
I can understand that. You're doing the right thing. So, Miss Sarah, like you told me that he's having some movement on his hand and legs, and so he's twitching, right? So, have you seen
Yeah.
his eyes going up?
Yes, doctor. It's staring. Sometimes his eyes are just
Okay.
fixed.
Okay. All right. Is there any specific time that it's happening, like in the morning or at night?
I don't think so, doctor. Like in particular times, it has happened in the
Okay.
morning as well as in the night.
Has it happened at school anytime?
He is not going to school for the last 1 year because ever since he had this first time fits at 4 years,
Yeah,
he's not going to his playgroup.
I can understand. Yeah. So, have you ever felt that he did he ever tell you that he is getting something before he gets this fits, like he is having some unusual smell or any flash of light or anything?
I don't think so, doctor. Uh, I wonder if he could notice all those things, but he has not told me anything like that.
Have you ever felt that when he's getting less sleep, he is getting this?
Uh, no, doctor. Like he's regular in his bedtime and other habits. I don't think.
That's good. Okay. Every time he goes, he will close his eyes or he lost the awareness of the surroundings.
Yes, doctor. Like sometimes I see him giving a vacant stare, and sometimes I feel he's not responding to anything. But most of the times it is only less than 5 minutes or so.
Right. Does he pass urine or poo or pee?
Yes, doctor. Like it's not all the times, but sometimes yes, he does pass the urine while he's having these moments.
Have you ever have to take him to the hospital because of this fits?
Yes, doctor. Like, but most of the times it does stop before I go to the hospital, and because he's already on this medicines for his fits,
Okay.
the GPs told me that I had to continue the medicines,
Okay.
so I'm
All right.
continuing it.
Yeah. So who is giving him the medicines?
I'm giving the I'm the one who's giving. But of it,
Oh,
for the last few months, I did have some few issues, financial issues. So maybe 1 or 2 days, I may miss it.
so have you ever? Do you remember that you're missing any time the medications for Sam?
Yes, doctor, but I try to give it most of the times. Maybe at the end of the week, sometimes I find it difficult. Maybe I will skip one day or two.
Oh, okay. All right. I can understand. But yeah. So what about other things? Like, have you ever felt that he is getting any fever together with this?
No fear, doctor.
Did he ever complain of any headache?
Uh, he did have a headache when he had this first episode at 4 years.
Uh-huh.
At that he was admitted and he was in the intensive care for 3 days, and then he was in the ward for another 3 or 4 days. But
Uh-huh.
after those admission part, he did not have any headache.
So do you remember that any investigations were done for him at that time of that
Yes,
admission?
sir. They did some scans for him, and the doctors at the intensive care told me that he is having some bleeding is there in his brain, so that's why he is having it's
So okay, he had some bleeding in his brain, and then he got this fits, right?
yeah.
Okay, and then what did they do for it?
The time the doctors gave some medicines, his blood tubes and to control the fits. And
Okay.
he did require some oxygen support also. He was in the ICU. They were doing multiple tests. And then they told that because he has this issue which is blood clot, so they told
Mm-hmm.
that that's the reason for his bleed as well.
Okay. Okay, so he is in the follow-up of which all doctors, Sarah?
Uh, yes, but I'm following up with the pediatrician and with the blood doctor, with the neuro, and the special nurse is there for him, and physio, and ortho, and the supportive. I would get some social service help, but still, I would require more help. And if you could help me, they have to.
Oh, okay, I can understand, Sarah. Um, have you when this happened, did you have any trauma before? Like, did
No,
he
no,
hit somewhere?
during the fits or even the first time, he did not have any.
Okay. There was no trauma. Okay. Okay.
Yes.
So, yeah, have you ever felt that his heart is beating very fast?
No, doctor.
No. Okay. Have you ever felt that he's going pale?
Nothing like that,
Like
doctor.
he's getting whitish, like, you have you felt it?
No, no, doctor.
Okay. What about his infection? He's getting any cough and cold often?
I would not say often, doctor. I have one more kid. His younger brother. He is 1 year.
Okay.
Sometimes he gets this. Sometimes this stuffy nose and fever. So occasionally we are living together. So occasionally he does get it from
Yeah,
his brother.
that
But I don't
happens.
think he settles it down. It's like 2 or 3 days.
Hmm. What about his bowel habits? His poo and pee is all normal?
Yeah, that's fine, doctor.
Okay. What
I don't
about
have
his
any issues
skin?
with that.
Does he have any rash on his skin or any different marks on his skin? Have you ever felt it?
No rashes, doctor.
Okay. What about his joints? All joints are good. There is no swelling or any joint pain.
He did have this joint pain and swelling, doctor. He has this. I was told that his blood is not able to clot, and he's having this joint issues. Actually, he fell
Since when
down.
he's having that?
He fell down at 1.5 years, and
Uh-huh.
then he had this right knee joint.
Uh-huh.
He had this right knee pain,
Okay.
and along with that, right knee was swollen, and he was wincing with pain for almost 2 3 days.
Okay.
And subsequently, he had some swelling and pain in the left knee as well as in his foot also, ankle also.
Okay.
And he was evaluated, doctor. Like as I told that he had an issue with his blood is not getting clotted. They told that
Uh-huh.
he will get this joint pain.
So this is from 1.5 years he's having this problem.
Yeah, yeah, yes, doctor.
So what tests were done for him for this blood clotting?
9 minutes up. 9 minutes up.
Oh,
Is my audio clear to
okay.
you?
Now
Is my
it is
audio
clear,
clear?
sir. It was muffling before. It was muffling a lot
Okay,
before. Now it's fine.
okay,
So this
okay.
problem was since 1.5 years, isn't it?
Yeah, yes, doctor. Yeah.
So he's getting any special medications for this? He's get
Yes, doctor. They told me that he requires some special injections, which was given like thrice in a week.
okay,
And I was giving it for almost 2 years. Then,
okay,
because of some financial issues in my family, I'm not able to follow for the last past 1 year.
okay. What medicine do you remember the name of the medicine?
I don't remember the name, doctor. They gave it as an injection. They told that it will improve his the way the blood is getting clotted.
Okay, okay, all right. And how many admissions you had in this past 5 years?
The first time when he had this, he had a fall and he had this the knee pain and swelling. We were admitted and they did a lot of blood tests. And after that,
Mm-hmm.
it was morely daycare of thing. We used to go there and have the injections and come back. And
Okay,
then
and did
the one is the last year when he had this fits, he was in ICU.
okay. That time also they said there is some clot in the brain, right? I'm bleeding in the brain.
But they told me that yeah, he had a bleed in his brain.
Okay. And did they diagnose any conditions in that year when he fell down and when he had a joint pain? Any conditions were diagnosed for him?
Yeah, yes, sort of. They told that his blood is not able to clot as it would
Uh-huh.
usually. So that's the
Uh-huh.
reason he's having this
All right.
joint pain and the joint gets swollen. So because of that.
Yes, yes, I can understand. So could you tell me more about his birth when you were with pregnant with him? Was there anything concerning in that time of pregnant with him?
No, doctor, like it was a normal pregnancy and not much was, nothing was even full there. And he was
Okay.
born, the normal delivery, his weight was 3.5, if I'm right.
Any
No
special test?
issues during that time.
The test done at the delivery? Anything was abnormal for him?
I don't remember anything like that, doctor.
Okay. All vaccines up to date?
Yeah, yes, doctor. Like I
What
try
about
to
his
follow the vaccines.
development? He is developing. He walking, running as his friends, like his peers.
Yeah, yes, doctor. He used to go to his play group only for the past 1 year because of this fits. I'm afraid to send him.
Okay. What about the same condition in the family? Anybody in the family has the same condition?
Uh, no, doctor. I have one more child, a younger chap. He is 1 year now.
Hmm.
Apart from that, I live with my husband. He's a teacher, and none of us have these issues.
Okay. What about your family? How are you coping with this condition of Sam?
That's a difficult part, doctor. Like I'm not able to do the regular follow because like I stopped working because this child got he required much attention, so I started working.
Mm-hmm.
And I had to manage both the child and my spouse is the only working person, so we have some economic constraints as well. I'd be happy if you would
Okay.
get me some support.
And you're telling me that he was missing the school since last 1 year, right?
Yeah, yeah.
Yeah. All right. Is there any other concerns that anything that is worrying you, Miss Sarah?
The thing is that I'm just afraid that he's having this multiple medicines for fits,
Mm-hmm.
and even though I try to follow the initial advice, but the fits is coming back, so I'm just concerned about that. And as
Yes,
well,
that is.
I'm just worried whether this could be related to his the joint uh, swelling and joint pain she had.
Mm-hmm.
His time is up.
Yeah, thank you.
So yes, doctor, can we just summarize?
Yeah, I have taken history from mother of Sam, who is 5 year old, who has recurrent episodes of seizure since last 6 months. And from the history, the positive points were that he is missing the medication since last 1 year. And also, he had a history of bleeding disorder, which was diagnosed at 1.5 years of age, with swelling of the joints. And he's missing school since 1 year. And also, they are having financial issues, social, uh, and yeah, no positive history in the family. Um, yeah.
Okay. So from here on, can we have Dr. Murtaza here?
Yes, sir. I'm
Okay.
here.
So would you like to summarize again the problem areas?
Today, we had the opportunity to talk to Mrs. Sarah regarding 5-year-old Sam, who was diagnosed to have a seizure disorder in the early days of life, and he has been on 3 anti-epileptics since then. But in the last 6 months, there has been increase in the frequency of these seizures. Along with this, he was diagnosed to have some bleeding disorder, which started from his knee, and then it involved the other parts of the joint, for which he is taking injections for it, basically. And because of these, he is missing his school since last 1 year, and the family is not able to like properly cope up with it, with this.
Okay. So how would you like to investigate this child?
So the investigation of this child will be on two basic parameters. First of all, I will investigate for his like breakthrough seizures which are occurring, and the second thing will be his clotting part. In the view of his breakthrough parts, I will first I will review all his previous records, and I will like to do a formal examination of the child, and I will like to see how the compliance of the drugs is there. 3 anti-epileptics are going regarding their compliance. I would also like to rule out any syndromes. It can be some syndromic association of the seizures, which can be there, and would like to see the drug levels for the like if the compliance is good or not. I'd like to see the drug levels. Along with it, like some of the anti-epileptics like valparin are enzyme inducers. So the levels of different like drugs which are being taken get hampered due to this. So I would like to see the drug levels first. Second, for the management of his joint swelling, I would like to see his complete blood counts to see for the platelet counts for it. Then I would like to see the clotting parameter, clotting factors, especially the factor 8, along with factor 9 and Van Willebrand factor, to see for the bleeding episodes which are there for him and to see their levels.
Okay. So how would you like to proceed with the management of this child, considering this child is having some problem with the clotting?
Right. So first of all, I would like to, like, as I said, I'll review the reports and do a formal examination, see if any other bleeding, any other history of bleeding is there. And there was a history of some brain bleed also in the initial part of history taking, after which the seizures started, which I remember. Second, I would like to involve my a multidisciplinary team, which will involve my consultant pediatrician in this, along with a hematologist, pediatric hematologist in this. I would like to involve the pediatric neurologist in this case, along with uh, the school liaison. I liaise with the school also and take the help of social support worker. So in the management of this child, as I told, if the drug levels are like uh, I'll check for the compliance, and if the drug levels are which I have got are not in the range, I would like to adjust the doses according to the different enzymes, doses of the anti-epileptics. Second, for the management of this, if I get my like after my investigations, I get like if it is factor like factor 8 deficiency, I am like hemophilia A. I would like to give him factor 8 depending on his concentration, and like he has him like joints bleeding and all. So I assume that it is mild deficiency only. So in those cases, I will give factor 8 levels according to the calculations which is to be given if it is factor 8 proven. The deficiency factor will be given basically along with, and in mild cases we can use even desmopressin also. because it is not a severe bleeding in this case.
Okay. So this child is having this recurrent seizures for the last 1 year. What do you think could be the cause of recurrent seizures?
So the first cause of recurrent seizure is like multi drugs are there. So some of them are inducers, like valparin is an enzyme inducer, which will change the drug levels of Levipil and carbamazepine. So it can be that proper therapeutic levels of the drugs are not being used. That is why I was going for a drug level. It can be also due to the like compliance issue. The drug is not being taken properly, because sometimes, as the mother said, that she is most of the time she is giving the drugs, but sometimes she is not able to give. That can be a issue. And the third thing can be, it can be with some syndromic association. The seizure can be due to that. So it can be due to that, which are normally difficult to control sometimes.
Okay. Now, this child has been on higher centiles for the weight. What do you think could be the cause of
So the
the
drug which we are
overweight for this child?
So the drug which is valparin, which we are using, it causes weight gain in these kids. So I think it is the cause of weight gain in this child. Side effect of
Okay.
valparin, valproate.
Okay. Okay. Considering if this child lands up with an acute joint swelling with pain, how would you like to manage?
So So if he lands with acute joint pain, and so first of all, I would like to uh, take the child, admit him, and then see for his. I will send his the basic investigations, which will include his factor 8 levels and his blood counts, complete blood counts, along with the platelet counts. And since this is a joint pain, it is considered that if the factor, I consider it to be more than 5% of the factor level deficiency. So I would like to give him like factor 8, and even desmopressin can be given in this case.
Okay. So what advice would you like to give to this mother
So I would
regarding if he is having a clotting problem?
So I would like to advise the mother that the child should avoid contact sports, and at school and even at home he should be careful with while playing along with his siblings. If they find any like bleed along with it, like any joint pain in future, it has to be reported to the hospital, because these bleeds are causing very much pain, and it needs analgesics also, which I forgot to mention along in the past question. So analgesics will be needed in those cases, and uh, basically these things.
Okay. Okay, doctor. Thank you.
Thanks.
Yes, time is up. Okay, now it's open to feedback. Yes. How we could
First of all, sir, in the history
this,
part, what I felt
yeah.
was a good history.
Mm.
But one thing was not asked, which is very important. When was the last dose adjustment done for this child? And that was not asked at all, because this
Mm.
child is on the 90th centile. It could be that his doses needed to be increased, and that was missed.
Yeah.
Other
So,
than
even if the weight is on 98 centile, usually we
Mm.
give the dosages for ideal body weight, isn't it, sir?
Yeah. So we do it for the ideal body weight, but
So,
here
obesity does not.
so one thing
So,
is we
obesity
have to
should
measure
not be a
the
factor, right, sir?
doses should be according to the body weight, and after reaching the maximal possible weight, maximum possible dose for that age, then we go to the next anti-epileptic, isn't it, sir? When one has
so
reached the
the
maximum.
yeah, see, in this scenario, there are multiple issues. One thing is this child is having multiple seizures ever since for the last 1 year. So there is a bleed definitely. After that, he is having the seizures, right? Am I audible now?
Yes, sir.
Yes,
You are
yes.
audible.
So because there is multiple seizures, he has been stepped on, so that history has to be elicited, like how frequent and whether it was initially one drug and why it is increased to multiple drugs. Because there was a recurrence of seizures, he had been on multiple drugs. So the issue is whether there is any drug interaction happening. So that should be addressed. And the mother clearly told that she has some financial issues. So the drug levels has to be assessed, whether the compliance is good. After that, whether it is adjusted as per the body weight. So if you're thinking valproate as the cause of an overweight, then the drug levels will give an idea about that. Okay, so here the scenario is like mother is not able to take the drugs properly because of multiple financial issues. The mother is repeatedly telling those things. So here it is.
So
The
it is
thing
due to
is
neglect, sir? Is it due to neglect you're telling?
not neglect. See, if the child is already having this joint swelling and joint pain, so the first episode happened after a fall. So this child is not going to school also for the last 1 year. So he is confined to home. Okay, so there is restriction of activity as well. That could also be the cause of the weight gain per se. Okay, so we don't know what is or multiple factors may operate together. So here the issue is the cause of recurrent seizures, as the question I was asking, you did mention about the poor compliance, you did mention about the drug interaction. The other thing is there is a weight is there on the higher centiles. So whether that is adjustment is done or not, so that should be addressed. And the other thing is there is a bleeding there. So whether that primary foci itself is causing the recurrent seizures, that is also still a possibility. Okay. So syndromic causes of seizures, here we have a clear cut. So if you listen to the initial part of the history, I was telling that there was a shaky movement on the right hand, right arm, and on the right limb. So it shows that it's something like a focal seizures happening because there is a bleed on the left side.
Right.
So syndromic seizures should not be brought here. Maybe it's a loss differential because we have a clear cut history of an bleeding in the joint as well as bleeding in the brain.
Sir, could it also be due to intracranial space occupying lesion as they are focal over a period of time recurrent?
Yeah, but would you like to bring it those in the first or in the last?
Not usually the first, sir. One of the DD, I meant.
Because the mother clearly has mentioned that he was evaluated and he has been told that there is an issue with the clot. So that's straightforward that there is an clotting issues here, and he is a male child. So all these things are fitting together into an more of a clotting disorder. If you would like to bring brain
Sir,
tumor here,
okay. Sir,
it
can we
could be the
consider
last.
vasculitis?
So again, it could be anything, but with this scenario, what are
Okay.
you going to arrange here? So are we
Hmm.
going to bring vasculitis tumor here in this scenario when there are no other pointers? But we have a clearly evaluated child who's having a joint bleed and who's evaluated already for a problem with the clot.
Okay, sir.
So,
Okay.
doctor, can we, in the initial history, can we ask since when he has started these fits? When was the first episode? How the fit
Yeah,
started?
I think it was asked and it was told that the first episode happened at 4 years. The child is now 5 years, and for the last
Okay.
6 months, it is increasing in frequency because there is an issue with the compliance. The mother herself admitted that she is not able to cope up with the multiple drugs.
Okay. So, in the current history, we'll ask this, or in the past history.
No, I feel that this is the presenting complaints should be elaborated in the current history itself. That's
Okay.
better.
Okay. Thank you.
Okay. Any others who wanted to add some feedback, like how we could improve the history part initially? We'll come to the discussion part later.
Sir, in history, we can even ask whether there was any seizures which started from focal and led to generalization.
Yeah, she did ask. I assume that she asked like how was the seizures, whether there's an upward gaze, whether all these things, loss of consciousness. She asked, and I think the mother mentioned as involving the right side, hands and arms and right legs. And I think the timing was less around 5 minutes, and it happens once in a week or once in 2 weeks. I think that's pretty fine. There was a maturation as well. Okay, any other feedback regarding the history part?
So can we ask about, have you ever made any video for these seizures in the history?
It could be asked. It could be asked because this is not the first episode, so the could be asked. Yes.
And what if the mother say yes? So how can we?
Then you can tell that okay at the end of the history, I would like to look into it. If that's okay for you.
Okay.
Sir, we can even ask like whether there was any trauma preceding the seizure. In case of reflex anoxic seizures, uh, this will be there. So just to
Yeah.
rule out that.
Yeah, you could ask. Yes. So the main thing is any foci causing this fever and meningitis that she asked, and she asked any rashes for the meningococemia part. And she came into, as she was doing system screening, the doctor has picked up that there is a joint swelling and joint pain. So then she has focused on those history. And she brought out that what are the admissions done. She did ask about the team. So in the team itself, I mentioned that he's on follow-up with the ortho as well. So joint doctor as well, I mentioned. So after that only she asked about the joint pain. Anyway, I have mentioned there itself. So it is a good question always to ask about the team. Okay.
Sir, do we need to even ask whether they are enrolled in any support groups?
Yeah, you could ask. Yes.
Because as there is a role of incompliance in this case.
Yeah, definitely. You could ask. You could ask whether she receives any social support, any that she has any access to support groups. Yes, because there are groups for such conditions.
Roti? Really? Fish? Yes.
Yes, others, please
Mithai?
mute yourself. Yes, Dr. Fatima, what is your feedback like?
Yes, Dr. Shabari.
Yes, what is your feedback like? How do you think you would like to?
I could have made my problem list little more clearer. Like,
Yeah. So I felt that you asked a good history. You didn't ask what are the points or whatever points I had. You did unmask all those things. But when you're going to summarize the history,
yeah, I could
yes,
have done better. I could
yeah,
have listed the problems one, two, three,
problems.
like that.
Because like the essence of history taking is not diagnosis for the RCPCH.
Yeah.
So they are not looking for the diagnosis, they are looking for the problem areas. So as I was repeatedly telling, divide your paper into like three portions, columns.
Yeah.
Yeah. The top portion, you as you're asking the history of present illness, just note it down in bold, whatever you're thinking, whatever is
Yeah.
very important finding. Say, for example, this child had a right side seizures. So that is a very classical history, and he had a bleed. So probably the bleed is on the left side, and he has a joint pain and swelling. So these things are things which are very clear on the present illness. And regarding the growth part, it is already mentioned in the leaflet that he is an overweight part. So you could have just touched a part when you're asking the history, when you're asking the perinatal history, just put a word upon the growth and the development as well. Okay, you did ask about the development thing, but still you can ask about the growth part.
Okay.
And having known that there is a clotting problem here, you could ask about whether any special precautions were taken for the vaccination. Okay.
Okay.
So that question
I
could be
asked
asked
about the
because
vaccine, but you said it is all done. But I could
done,
ask
yeah.
like any precautions done because there is a
Yeah,
bleeding.
yeah. So because we are the history is more of a problem with bleeding, you could ask that. Okay. Others, can you please mute yourself?
So, sir, if you will say the problem list, I could say that refractory seizures, joint swelling, intracranial bleed, social non-complaints, and what else could be added? And
like not able to go to school, play groups is
school
missing.
absenteeism.
Okay. And being on multiple drugs and increasing weight.
Yeah, obesity. Okay.
Obesity. So this could be summarized. Okay. So one other thing is like always ensure that you are doing a system screening, because if you have not asked about the joint pain, then the whole thing is missed out. So ensure that you are, even in an unrelated case, just you are going to do a system screening. But generally, the role player or the examiner would like to give a clue, because even before you asked about joint pain and swelling, I did mention about the team that he's having some problem with the way the blood is getting clotted. It doesn't clot usually. So generally, the examiners are good. So, but you have to do the system screening so that you pick up the right diagnosis. Because if you have not asked about the joint part, or if you have not listened to the clue, then you would have missed the major part. Okay.
Sir, could you please summarize this, sir, if you could?
So, summarize the last point what I was talking now.
No, sir. Summarize when we have to summarize the case to the examiner after taking the
So
history.
today I had the opportunity to take history from Sarah, mother of Sam, who's a 5-year-old boy. He is presenting with convulsions, right side focal, and it is there for the last 1 year, and it is increasing for the past 6 months. And the mother has issues with the compliance of the drug because of some financial issues. And he's also having this increasing weight, and there is an economical constraints in the family as well, and he's missing his school for the past 1 year because of these seizures. There is no history of fever. There is no history suggestion of any space occupying lesions with my history. However, I'd like to do a full examination as well as a detailed serious examination to rule those things. Is it okay?
Yeah, thank you, sir. Sir,
Sir, I have
ideally
a
we should
question.
finish the history in 45 seconds to 1 minute, right, sir?
Yeah.
Okay. Sir, if you don't mind, how would be the time, sir? How much time do we need to go for the history, and how fast we need to summarize, and then how fast do we need to answer, sir? And how many questions we are expecting in the history, sir, with the examiner?
Yeah. So if it is an case like acute case, say for like this case where you have a convulsions, and you are going to unmask a major diagnosis, the diagnosis is not clear. I would say for the present and the past, which is the topmost box of your paper. So as I told you, divide your paper into 3 columns, 3 sections. So the top section is your present and past, complaints, present and past history. Here, for this case where your diagnosis is not sure, you could allot a full 9 minutes here. Okay. So that essentially you get the diagnosis. And the second column, the second portion of your paper, where you're going to ask about your antenatal growth, development, vaccination, other things. Here, there is not much of an information except for the vaccination part. Assume that there is one question to be unmasked in each of this part. Okay. So the second and third part, the third part is the family and the social history. That's the third part. So here that we have an younger sibling. Okay. So who needs to be screened as well. So that I come to in the management. Apart from that, there is a social issues and financial issues. The mother is not having a job. She is finding it difficult to have time for the job, as well as there is a financial constraint. So these are the issues in the social and family part. So all these, the last 2 part, the antenatal, the perinatal part, growth and development and vaccination. Along with that, the family and social part could be given 4 minutes. So 9 plus 4 in a scenario like this. Now, if you are given a scenario where you are going to, the diagnosis already established, say, for example, a child with asthma, you are going to take a history, or a child with diabetes mellitus, you are going to take a history. In that scenario, it is like you already have an diagnosis in place. So there, I would say you divide as 7 plus 6, meaning the present and the past, it should be 7 minutes. And having known the diagnosis already, the emphasis is more on the other part, the social part, the family part, the complaints part, the treatment part. So give more importance to those part, the second and the third portion of our history. Is that clear? So either it is 9 plus 4 for an acute illness, or it should be 7 plus 6 for a chronic illness where your diagnosis is already known.
Yes, sir.
After that, the end of your thing, always you can put up a question is there anything important, Mrs. Sara, you could tell me if which I could have missed in today's history?
Yeah. Is there anything important you could tell me, right, sir?
Yeah. So that question you could always put at the end if you have a time. It is always a good question to put, so that generally the role players and examiners are kind enough. They will give you, if at all you have missed anything
Clue.
major, they will try to give a clue there. Okay. So once
Sure,
your 30 minutes is over, you will be asked to summarize the case. So at that point, try to give a summary of the points which you have written in your paper, highlighting those are the important points. So here I want to focus on the seizures on the right side, focal seizures, and a left side bleed, and a joint pain, joint swelling, and a poor compliance, and increasing weight, and being on multiple drugs, economic issues, and school absenteeism. Plus, if at all you want to give a negative history, tell the hard-hitting negative history. As I was always used to tell that when you are going to give a history, if you're unsure of the diagnosis, you should have a 3 differential diagnosis for the given scenario. Out of which 3, 1 should be like what you are thinking after taking the history. Okay, so that is a first thing. Okay, which is correlating with your the full history. Now, even before you enter the room, you have a scenario like this with the seizures. So what are the hard-hitting diagnosis you can have for seizures?
Hard-hitting means
I mean, a bad diagnosis. A bad diagnosis. Yeah, probably a meningitis, probably a tumor. Okay.
tendinopathies.
So, like the whole idea of RCPCH is to evaluate whether you are a safe doctor or not. Got it? So when you're going to summarize, the examiner would be happy if you're going to tell only those negative points. Like there is no history of fever or no suggestion of any space of lesion as of now. But I would like to do a detailed evaluation, tell the system to proceed further. That is the way you're going to end your history. Okay. So the 4 minutes when you are waiting outside with the given scenario, think of 3 differentials, out of which one should be the differential which you think after taking the full history. So that should be the first differential. Okay. The second differential could be the one which is a very bad event for the given complaint. For the seizures, the bad event is definitely a space occupying lesion or a meningitis. Okay, meningoencephalitis. Now, maybe it could be a seizure disorder as well. Okay, there is a bleed. Then there is going to be some amount of scarring may happen. There could be a scar seizures as well. So those seizure disorder could be eventually develop. So that could be maybe a soft differential down the lane. So all I want to tell is like, think of some 3 differentials, out of which one should be the commonest and one should be a really bad differential, which you want to rule out, emphasizing that you are a safe doctor. And always give the first differential, which is fitting to your history. Okay. But all these you will tell after summarizing the problem areas. Okay. So always remember that the objective of history taking is not to have a diagnosis, but to summarize the problem areas. Now, why do you want to have think of 3 differentials outside the room? Because you want to ask those history in the present illness. Like there is no history of any projectile vomiting or any a headache or a severe headache or any fever. So these are the few negative history you should always ask so that you have ruled out those things. Okay. Yes, somebody was asking something.
Yeah, hello, sir.
Yeah.
I want to ask a question.
Ah.
Yeah, in this context, noting the central child at 98, this child is either obese or the child is overweight. What attributory factor will be responsible for this weight gain? And it
Weight
was
gain.
also
Yeah.
stated that the child is not gaining height. The child is on the 12th centile, and the child is overweight or obese to an extent. So what attributory factor here are we going to look
yes.
at?
So the question as for the weight gain, one of the answer was the drug probably. So that is the reason. The other reason you could tell is there is restriction of activity. Probably because the mother thinks that he goes out and he falls down and he has a joint swelling, and the mother is not able to go for the injections also, fact, right? So like he is not going to school also. So all these are contributing to that less of physical activity that could also contribute to the overweight part. Okay.
Thank you very much.
Now regarding the management part. So the standard questions usually is, how would you like to investigate? After you summarize the problem areas, there are very typical questions as this. I think somebody is. Dr. Shanila, can you just erase those things? I think for you.
Sorry, I don't know how it's happened, but
Okay.
I'll have to remove it.
Okay. Okay, then just leave it up for the next issue.
Does nutritional history important in this case? Because nothing was asked from that.
You could, yeah, you could. So in the second part of your history, you could cover all those things. You could just put up a word there. Okay.
So how to ask in very short manner so that no waste of time? How nutritional
So
history?
you could ask about the appetite.
Okay.
Okay. So ask about the appetite and ask about any recent change in his feeding habits. Okay. And just ask the mother whether are you following the centiles. So if you ask that question, then the mother will tell, okay, yeah, we are following it. The GP told me that it is somewhere on the higher end. And like that, the story will unfold. Okay. Here we cannot ask any, I mean, the detailed history of diet and all. And regarding the question part, the standard questions are, how will you investigate, how will you manage, and what advice you would like to give. So these are the standard questions. Okay. Now investigations here, investigations for the diagnosis, investigation for the baseline part. So for the diagnosis here, I think we can tell about the starting. I think the doctor has covered most of the part. Whatever the answer Dr. Murtaza has covered. The left out thing is always tell that you would like to liaise with somebody. Okay, you will not decide upon the investigations. You will liaise with make your consultant, discuss with the consultant as well as with the hematologist before you do clotting studies. Okay, from your level at the primary investigations, you can do PT APTT. Okay. So clotting comes next. Okay, so start at the baseline investigation, PT, APTT, and then you can go for higher investigations. And here the issue is more of seizures, presenting with seizures. So here you can tell about you would like to liaise with your neurologist for the imaging, probably an MRI. Okay, to look for any gliosis, is there any gliotic seizures would be a possible, those things you would like to discuss with the neuro and like to take a call on the imaging. So that is a point I would like to comment about the investigations. And apart from that, other things are told by Dr. Murtaza. And the treatment part, so again, as we were discussing in the previous scenarios, previous classes, whether it is an acute event or a chronic event. If it's an acute, so think about admission, isolation, and stabilization, those part. If it's a chronic thing, think about the review of the old records and what we are going to do for address the current issue. So that is the first step. So here seizures recurrent. So maybe you would like to have an discuss with the consultant and decide upon the admission to look for any thing in the brain, maybe a requirement of an imaging, those things. Okay. And other thing is you would like to see the old record to look for his baseline thing because he was evaluated at 1.5 years. So you would like to know his baseline factor VIII level because based on that only your current treatment regime and everything is going to change. Okay. So the dose of factor VIII depends upon the current doses required upon the what is the baseline of the patient. So that is what I was expecting, that line that you are going to look at the baseline factor VIII or not. And the mnemonic, the fire, I used to say that. Okay, so after you tell about the whether it is an acute or a chronic approach, then tell about the team, multidisciplinary team, then just mention the specific therapy. I don't, it is not required to know the formulas and other things, but just tell that we're going to give a factor 8 here. Definitely, tranexamic acid is not, I mean, those things are like maybe down the list because we have a bleed here and multiple joint bleeds. So definitely this child is moderate to severe, probably a severe hemophilia requiring factor 8. So after your approach to acute or chronic event, then your team, multidisciplinary team, then the specific therapy, that is a factor 8 here. Then remember the mnemonic fire. I used to tell that the follow-up part, F for follow-up and first aid. So always what you're going to tell for the follow-up and when to follow up, whether you're going to give any open access, whether you're going to tell about any first aid measures for the seizures, whether you're going to give about any nasal spray, something like that, or counsel the mother what to do. Okay, so that is the first part. Then the immunization part. I just think that this immunization is complete or not. You would like to review the records. Hepatitis B, particularly, you want to look at here and emphasize, ensure that that is being done because we are going to go for a factor 8 and maybe in the future he may require some transfusion in an emergency. So you want to ensure that he's having the vaccination done. The R part, referral. The mother is repeatedly saying, I need social help. So referral to social services, referral to special nurse because there is a special nurse for hemophilia. And giving a referral to the school because he requires some special attention. He should not have any trauma, minor trauma there. So you would like to emphasize the he needs to go to the play group as well as you need to ensure that he is safe. So you need to give referral to all these people. So think of social services, special nurse, and referral, giving referral to school also. And E for evaluation of the family members. So here we have one more child, younger sibling, brother is there. So have a bleeding disorder, so you need to evaluate those child also. So like evaluation of the family in terms of whether genetic screening is required and in terms of whether the family requires psychological support and social support. So either you could have as a mnemonic FIRE or you could remember these steps because the management is not just simply drugs, it is should be a wholesome. So when the examiner asks management, you should include all those things. Okay. So generally after the investigations and management, the common question, third question is advice. Advice here should be like informing the GP about the problem and avoiding IM injections, yes, and avoiding NSAID. Sometimes they may cause a GA bleed as well, but generally mucosal bleeds are uncommon, but still NSAIDs should be taken with caution in hemophilia. And in case he is having his dental checkup, the dentist should be informed about this factor deficiencies. And where the mother will land up in case of an emergency, like whether he will have an open access, whether he will have any bracelets or anything to ensure that he is known, and ensuring he is given the vaccines, and there should be precautions should be taken to the vaccination. So the like you will give a letter to the GP to ensure that those precautions are taken. It should be given subcutaneously and not on an intramuscular. And modifications at home and modification at school to ensure that he doesn't fall down or he doesn't have any trauma there. So these are some generic advice for the bleeding things. And apart from after you finish up this question, there will be one or two questions which will be unique for this scenario. So here it will be like the cause of recurrent seizures and the cause of weight gain. So I think we have discussed those things, the reason for weight gain and the reason for recurrent seizures. Is it okay? Somebody has to
hello,
mute.
sir.
Can somebody text it?
Hello, sir.
Yeah.
Yeah, sorry. Okay, I think there's a noise on the background.
Yeah,
All right,
there's a
it's
background
muted.
noise. Somebody has to.
Yeah.
Who's that? Dr. Christian?
Yeah, Dr. Christian.
Zoom.
Any child.
Yes.
All right, hello. Okay, any
Yeah.
advice on this child engaging in any sporting activity?
Any advice on discharge?
Any advice on this child in relation to any sporting activity? Is he engaging in any
Yeah,
mild
sports activity. Yes, yeah.
exercise?
Contact sports. Contact sport. Dr. Mutasa mentioned regarding that.
Okay, he has to avoid it.
Yeah.
Okay.
So is that okay? Shall I go to the next case?
Yes.
Okay. So Dr. Gitanjali is there. Am I audible?
Yes, sir.
Yes, sir, you're audible.
Yeah. Dr. Gitanjali was volunteering for this. Dr. Gitanjali is there in the group. No?
Yes. I'm here.
Would you like to do the history part?
Okay.
Okay. Does anybody want to volunteer for the management part? Okay, your time starts now. If somebody wants to volunteer for the management part, they can post here or post in the group. Dr. Gitanjali, you start start reading the
Okay.
scenario. Yes, could see in the chat box about rice. So there is the answer I was expecting when I was asking the question. How would you like to manage in this child presents with an acute joint pain? So you could remember the mnemonic price or rice. Price, P stands for protection, or it is rice. Rice is rest, ice, compression, and elevation. Do we need to ask questions from every system or related to history? Try to ask depending upon the time. So I would say always related to the history first. And if there is time, then definitely go for the screening part of system. You could just touch upon the system, do not ask in detail. Regarding pattern of history taking, yes, either it is 9+4 or 7+6, depending upon the scenario. Okay. Yes, if you're done, we can start.
Oh, okay.
Dr. Gitanjali, would you like to have the video on or off?
Yes. Yeah, I can put on.
Oh, okay.
Shall I start?
Yeah, yes, doctor. Yeah. Yes. The time
Hello.
starts, yes. Hello,
Yeah.
doctor.
Yeah. Hello. I'm Dr. Gitanjali, one of the registered doctor from this hospital. Am I talking to Mrs. Mary?
Yes, doctor. You can call me Mary.
Okay. Okay, Mary. Yeah. Are you mother of David? Isn't it?
Yeah, yes, doctor. Right.
Yes. I have received a letter from referral letter from GP, your GP, that about David. I'm going to ask you a few questions about David condition. Is that all right?
Yeah, sure, doctor.
Then would you mind to tell Mary about David? What is the present problem in? Can you elaborate a
Uh,
little bit?
yes, doctor. My child, David, he is now 6 years, and he's having this tummy pain for the last 2-3 days. I thought initially it was like a colicky pain, and it was the usual colicky pain he gets occasionally. The children used to get. But then I could find that sometimes he is crying, and he gets really nasty when he had this pain, and I couldn't just see him, doctor. I'm just really proud to see him when he having this pain. He just rolls in the floor, and I think the pain is very severe. For the past one day, I feel that this pain is frequency is getting increased. So I went to the GP, and GP told to meet you, doctor.
Okay. Then 3 days before, David was completely all right. Is it?
Yes, sort of, doctor. He did not have abdomen pain before that. His tummy was okay before that. But he did have some problem in the skin. There was some red rashes, mainly in his this part of his arms and in the front of his legs. But that got subsided, doctor. He was okay with that. I'm not sure whether that is related to this pain. Just want to tell that.
Oh, okay, Mary. Yes, I can understand. And is the pain means how long it stay, the pain?
It's there for 3 days, doctor, as I told you. And
Means
for the past one
like
day, I could find. Yeah.
sorry, in the day, means like once it starts, means does it subside with any?
Yes, doctor. Like it is intermittent, doctor. Like maybe it happens in once in 2 hours or 3 hours once, and like he cries due to pain. He says his tummy is aching very much, and then after some few minutes, he gets okay. But I could find that for the last one day, it's really worse, and he started vomiting also. So I just want to get your opinion.
Oh, okay, Mary. Then do you give any medication for that?
The
Pain?
GP gave me some medicines. GP gave me Gaviscon and other things when he had the pain on the first day. But I don't think he is improving with that, doctor.
Okay. Then you mentioned that you got some rash. Then it was in anything in the lower part of the body or any?
Yeah, doctor. It is more on the front, on the backs. But I could see some rashes even in the arms also. I mean, in the behind the arms, he had some. But yeah, it is more in the legs. Yes.
Then does it uh, means have you noticed is anything increase the pain?
The tummy pain, doctor.
Yes, tummy pain. Yes.
Um, I couldn't notice anything. He had this pain even before the feeds and after the feeds, if you're asking that. And he had his pain in the morning and evening, sometimes in the night also.
Means not specifically associated with any
Yeah,
anything
yeah,
increase.
yes.
Okay, and does any postures or anything relieve the pain? Any?
No, doctor. Like, sometimes he is wincing in pain, and sometimes he just flexes his arms and legs like this. Uh, but I'm not sure that that is relieving him either.
Okay, then the pain you mentioned that he vomiting when he
Yeah.
after vomiting, does he feel better?
I would say not better, but maybe partially he's relieved of his pain.
And does the GP did any investigation regarding this pain?
No, doctor. The GP gave me the Gaviscon, and after he had this vomiting and it is not responding to his this medicine, so he told me to meet you so that you could help me out.
Okay, is David he is taking any medication, any other medication regular basis?
No, doctor. He used to have this cough and stuffy nose occasionally. Maybe even some 3-4 weeks back, he had this flu something, but it got well on its own. He did not require anything, and he's not on any long-term medicines as such.
Oh, okay, Mary. And does in the past did he admitted to any hospital or anything, any infection, severe?
Uh, no admissions, doctor. Like he did not require an inpatient treatment in the past, but yeah, he did have this some joint pain, and he had the similar set of rash 1 year back. But it was managed as an OPD basis, like they gave some pain medicines. I think he got better.
Okay, then he did not get admission,
Yeah,
just outpatient basis. Okay,
yeah.
and then is there any trauma in the history in the past? Did he get any?
No trauma, no trauma, doctor. I used to ensure that he's safe.
Okay, and is he then in the family? Is anybody have any kind of long-term illness?
No, doctor. Not in my family. I have 2 children, and I have one more elder sibling, male child. He's 8 years, and David is 6 years. None of us in the family have issues like this.
Okay, okay, Mary. Then would you mind to tell that is he able to sleep properly? Is
Yes, doctor,
any
but for the past one day, as I was telling, this pain is increasing, and I did find that he gets his pain in the night also, and sometimes it is interrupting his sleep as well.
okay? And what about his school? Is he going to school regularly?
Yeah, yes, doctor. He is going to his kindergarten, and only in the last 3 days, because of his stomach pain, I didn't send him to school. Otherwise, he goes to the KG, and he used to have friends there and he used to play well. 9 months up.
Okay, okay. There is no concern about his school. Means he's okay. He enjoy the
Yeah,
school.
yeah, yes, doctor. He enjoys with his friends and he plays well. Yeah.
And what about his activity? Does he do play and do other activities? He's okay, fine with that.
Yeah, yes, doctor. Like, I don't find any difference compared to his elder sibling. Like, he does what is appropriate for his age, I think.
Okay. And is means like about his growth? Have you got any concern about his growth? He's growing well as according
No,
to his
doctor.
peers.
No, doctor. I have no concerns with his growth. I think he's quite okay. The GP does follow them on centiles, and I have no concerns regarding those.
Okay. Did you is there any in the past recently have you traveled anywhere?
Nothing much, doctor. Nothing much. I could remember in the recent past.
Okay. And is David's I would ask about in his childhood, means like during his birth, is there any problem? Anything you can remember and tell?
Yeah, doctor. It was the antenatal period was uneventful. I couldn't remember anything going wrong when he is in my tummy, and he was born on normal delivery, and he was I think 2.8 kg, and everything was fine.
Did he pass the meconium? Yes, like that poo
Yeah,
in
yes, doctor. He
within.
did pass that. You mean that green color stool? Yeah, he did pass it on. I think after some few hours of the birth, he passed it, and they did
Okay.
some test also from his heel, and they told everything is okay.
Oh, okay. Then in your how is it about his feeding? Is he eating well?
Yeah, yes, doctor. I have no concerns with that, and he's. I think his appetite is good, and his pee and poo habits are okay. Except for the last 3 days, I think he is passing a lot less urine compared to what
Okay.
is usually. Maybe he's vomiting. I'm not sure.
Okay. And is he getting like when he is passing wee? Did he tell anything like he's getting pain that time?
No pain, doctor. Thing is, I could see that he is not paying usually as usual, but I don't think he's having any pain.
Okay. Then is he allergic to any drug or any kind of food?
Nothing so far, doctor. Like, not encountered any allergies so far.
Okay. And what about his jab? He has taken up to date. His jab is up to
Yeah.
date.
Yes, doctor. Yeah. Yes, doctor. I have had all the vaccines are done so far.
Okay, that's good, Mary. And what about his development? Like he's sitting and sitting, standing, walking, everything is up to
Uh,
date.
yes, doctor. I think he was doing like his elder brother, and right now he is in his kindergarten, and he mingles with other children and he plays with them. I have no issues regarding those things. I think he's bright.
Okay, then
Time up. Time up. Yes. Yes, you proceed, doctor. Like, can you summarize the case?
okay. Today I took history from Mother Mary about 6 years old boy David, and he is having a pain abdomen for last 3 days, and he went to the GP and he was given some Gavascan anti-acid drugs, but he was not okay with that, and uh, is he has got rash over body, and the mother's main concern, the David is not able to go to school for last 3 days because of the severe colicky pain, and he's vomiting during the episode, and he's unable to sleep as well because of the pain, and there is no past there is no history of any drug uh, regular drug intake, um, and he has no history of any recent travel.
Okay. Okay. How would you like to investigate this child?
I would like to do the like uh, to rule out any infection. I'll do full blood count and inflammatory marker like ESR-CRP, and I want to do the dipstick like urine and urine routine microscopy. Mm. Yeah. I did not ask about any joint. Okay.
Okay. Any further investigations would like to add?
Yes, I would like to do USG abdomen and
Okay. Considering your history and what are the differentials you could think of in this scenario?
it is like due to colicky, then any renal colic.
Okay.
Because he has got reduced urine output and maybe obstruction, any acute.
Okay. How would you like to manage David?
First, I would like to do the thorough general examination, and I will consult with my consultant, and then first immediate I will do approach like ABC approach, and I'll give something to relieve pain like paracetamol. And because he is having reduced urine output, I will take care of his fluid intake. I'll advise mother to um, give him more fluid. If he is vomiting, then I'll be thinking about to admit the child and give some IV fluid. And if like in investigation, if there is any infection, then I'll think about any antibiotic.
Okay, doctor. Okay. Thank you. Yes. So yes, we'll go for discussion. Okay. So like, doctor, what was your thoughts when you are reading this scenario? Like, imagine if this is an exam scenario, you are outside for the 4 minutes with this scenario. What are your thoughts? What are the differences you could think of?
Yeah, first it is. I thought it is a HSP.
Okay.
Mm,
Did you have HSP in your differentials outside the station before entering to the station?
yes, I first thought HSP,
Okay.
but I did not ask regarding this.
Yeah, I'm surprised with that. You did have a right diagnosis outside the station, but you did not ask any questions to the HSP in your present illness as well as in your management plan differentials, and you're asking your differentials. Okay, fine, no issues. Like we all have that, we all get that. Okay, no issues. Now, apart from HSP, did you have any other differentials?
Yeah, maybe like UTI, then testicular torsion, and
So, as I was telling in the previous discussion, like it's better we have some three differentials. Okay. So leave out the one differential abdomen pain, which we will get through as we go into the history. Okay, that is the first differential we are going to give anyway. Now, what is the hard differential you can have it here? Like a child with abdomen pain. What is a really a bad? What could be a really bad differential? with an acute abdomen pain for 3 days?
Like any acute obstruction,
Yeah. Yes.
like
Any surgical
ischem-
condition?
yes,
Yes.
any
Bowel
like venous
ischemia.
obstruction, yes,
Yes.
bowel ischemia.
Yeah.
Like
So because even
gastroenteritis,
before, pardon?
any G testicular
Yeah.
torsion,
Yeah. So leave out any surgical conditions. Okay. So acute abdomen pain, the bad differential, I could think even before entering the room is I had to rule out any acute surgical emergencies because this is in history for 3 days. Okay. So, so for that history, we could always ask whether the vomiting is bilious or non-bilious, whether there is any tummy distension. Okay. Did the child pass stools or not? Okay. Is there any blood in stools? Did the child pass the flatus? Or is it a surgical abdomen or not? So these are some hard-hitting questions: bilious vomiting, not passing flatus, or blood in stools. So definitely should be asked as a part of negative history for this case. Now, after you were asking about the history of placental illness, I was telling about abdomen pain. I was telling about rashes a week back. I was telling about a respiratory illness priorly, and I was telling about a decrease in urine. So could you connect all these things together? So abdomen pain, then a decrease in urine, a rash, and a prodrome illness a week before. So it could very well easily fit into your initial diagnosis of HSP. Okay, the one diagnosis which you had outside the session. So apart from HSP, like as I was telling, abdomen pain, rash, what are the other differentials you could think of? Now you could think of your other differentials. You have some more clue as you are asking the history. So you did ask about rash. I mentioned the rash more in the legs. Then I told about abdomen pain. Then I told about the decrease in urine. Could you think of anything else? So we have a renal shutdown here with a rash, with an abdomen pain. Could be any vasculitis apart from HSP, maybe any the differentials of an acute renal failure you could just even think of here. Okay, so like maybe it is an acute glomerular or think of even maybe an HUS-DTP spectrum, something like that. So there is no preceding diarrhea you could ask. It could be SLE, that is there any photosensitivity, any facial rash, any rash on the sun exposed spot. You could ask any other bleed anywhere. Say for example, we have a rash here. Is there any bleeding manifestation anywhere else? Okay, so any mucosal bleeds, those history you could ask. Okay. So basically, if you think it is HSP from the history, then you should always ask the negative history of things which are co-related to HSP. Like it could be an maybe it could be an SLE, maybe it could be an acute glomerulonephritis of any other cause. Also, the rash spot you can.
Joint pain and swelling could have been significant if it's HSP.
Pardon? Yes, doctor.
Joint pain and joint swelling. That can also be a significant finding.
Yeah. She did ask about the past history where the mother told that there was a rash and joint pain 1 year back. So it could be a recurrence of HSP, or it could be maybe a connective disorder like an SLE with rash and joint pain. So now it is presenting with an abdomen pain and maybe a renal shutdown, having an oliguria. Okay. So the thing is, outside the room, we will have some differentials for the whatever symptomatology given, and as you go into the history, think of related differentials. So you ask some negative history for those things. That should be fine. But here you did ask about the past history of rash and joint pain, and somehow I think it did not come together for you. No issues, like we can always pick it up. Okay. Now, apart from this, the other part of the history, the family history, always ask. And other thing is, one another thing I would like to give comment for you is like your history part is like here and there. Like you are asking about present illness, then something about the past, and again about the present, then somewhere about the family, then about the perinatal history. So try to have a format and try to go with the format so that it doesn't look like you are moving here and there. And if at all, say for example, if you forgot to ask anything, any important history, say for example, was there any periorbital puffiness or any facial puffiness? Imagine that you have forgot to ask those history. You can very well ask those history at the end of your thing. Mrs. Mary, I'm sorry, I forgot to ask, like, is there any facial swelling or any puffiness over the eyelids when he gets up in the morning? So even you could ask, even after going to the family history, also you can ask, but let us not jump here and there at multiple times. Okay. So if you have forgotten something, then like try to remember at the last and have those questions at the last. And in the family history, always ask about the what is your husband is doing, because here I mentioned only about myself and the children. Was there any social issues? Was there any financial difficulties for me? Always ask those things, and always ask about the spouse also. Maybe I will tell I'm separated and I'm taking care of both the kids. I'm finding it difficult, so that I will tell something. Okay. So ensure that you take a complete family history. Always think that in the three domains I told, the present and past, there will be definitely a key finding which you have to unmask. And similarly, in your parental history, in your development, and in your vaccination and growth things, there will be some event which has to be unmasked. And in the family and social part, there should be an event which will be unmasked. So it is usually they will have some one key history to be unmasked in all these three areas. Okay. So when you're asking history, just think that there is something which we have to ask, which is there in this part of the history, which I should make the candidate to tell out. Okay. So if you put the question nearby, then the role player will tell those things. Okay. Just like as we are in attention to answer, I mean to get the diagnosis, even the role players will be in attention to give out the whatever history they have been asked to tell you. So if you go near those areas, then they will definitely give out their things. So here the differentials can be maybe after if you ask the facial puffiness, oliguria, rash, then abdomen pain, then a past history of an joint pain and rash. So then I think this could be a recurrent smaller cell vasculitis, maybe an HSP here. Then it could be even SLA. It could be it could even give a ITP differential here because there's a rash and following a viral prodrome, and other things could be clubbed with an global nephritis or another cause of an renal issue. Okay. Now the last differential definitely is surgical conditions should be ruled out because the child is having an acute abdomen pain. So that is definitely a bad differential that would be ruled out in this history. Now, if you have such differentials, the investigations, I think, will be more towards HSP. So you will tell about routine urine, looking for urine dipstick, then looking for the urine protein, maybe an urine PCR or maybe an USG-KB, USG abdomen. Okay, so you will bring then those things into the pipeline. Then you would like to liaise with the nephrology, with the dermatology, and like to bring the whole management into the picture. Then the baseline renal function test, electrolytes should be brought there. Okay, so like once the differentials are clear, then you will be able to get those things. Okay, like if this is imagine that if this is going to be a case of an HSP, like how would you like to manage? How do you approach the management? Yes.
Yes,
In
first,
case
okay, first I will give some painkiller, and
so the previous
give
approach what I discussed, whether it is an acute or a chronic case. So here we have an acute. So abdomen pain, child is having vomiting, pain is increasing intensity. So you would like to admit the child. Okay.
Yes, first.
So you would like to discuss with your consultant and admit the child. So admission, then stabilize the child. The child is having a decreased urine output. Maybe he is having a high BP. So you would like to record the vitals, stabilize the child first, considering the scenario of an HSP here. Okay. So then we can tell about the multidisciplinary team. So tell about who you want to get an opinion. So you want to involve your consultant. You want to get definitely a surgical opinion. He's having abdomen pain. Definitely opinion from the nephro if his initial renal parameters are abnormal or if his urine dipstick is getting you some surprise, then you would like to involve the nephro as well. Then tell he had a skin rash also, so maybe you would like to have an derm opinion. Okay, so the family history, the mother has some social issues in taking care of the other child, so you would like the you would involve the social support as well here. Then the main treatment, if it's HSP, if it's an abdomen pain, then steroids. Then you like to involve the team and decide upon whether any further immunosuppression is required, depending upon the organ involved. Okay.
Yes.
So
Here we
then
can
yeah.
refer
Yes,
to
doctor.
rheumatologist as well. Rheumatologist.
Yeah, you can include in the team, yes. And then the other part, the follow part, and the if he has any emergencies. So what are the few things the mother will watch for,
Yeah,
like
blood pressure.
monitoring the child. Yeah.
Yes, blood pressure monitoring for
Yes.
um,
Urine dipstick, maybe
yeah,
urine dipstick.
urine
So
dipstick every week, yeah, weekly until it is negative with
yes,
protein,
yes.
and blood pressure and GP follow up.
Referral to GP for follow-up. Yes. So
And
like
blood pressure for 6 months, 1 year.
yes. So I think those things are very clear in the guidelines. Okay. So like
Yes.
how you're going to monitor, like either it is monthly, what are you going to monitor monthly BP monitoring for 6 months, and you are going to do weekly dipstick. When you're going to have a GP follow-up and when you're going to have a nephro follow-up, depending upon the urine protein, if it is 1+ or less, or if it is more than 1+. Okay. And what are the indications for a nephro referral in case if it's an HSP, like an adult renal function test, a hematuria, or a macroscopic proteinuria. So those are like points for a referral. Okay, so like other things, what are the complications in a male child with HSP? Apart from the usual thing like an intussusception or an pancreatitis, perforation. What are other GI complications? Just think of orchitis also. Okay, so male child orchitis. So bring those things into the picture. Then indications for admissions in case of an HSP. So I think those are there, the guidelines. Arthritis involving 2 or more joints, then orchitis, then moderate to severe abdomen pain, GI bleed, okay, proteinuria, hematuria, macroscopic hematuria, and significant proteinuria. These are indications for admissions. And these are the questions. Standard questions should be like when you're going to have a nephro referral and indications for admissions and causes of abdomen pain and HSP. So these are very standard questions. Now, advice, if at all, if you have time and examiner asks, what advice would you like to give for this parent? So think of generic advice for a renal system. Okay, so I would say you try to have advice as per the system wise. Try to have some generic advices. Like for cardiovascular system, you will say like avoiding tattooing, avoiding high altitude, or avoiding overexertion. Like that for the renal system, you can have something like avoiding dehydration, avoiding pain medicines. Okay, ensure that his BP is followed up as per the advice, and ensure that his urine dipstick is being followed up, and teaching the mom about when he has to have a meet the doctor. Okay, so like these are some generic advice for the renal part, avoiding pain medicines to avoid the nephrotoxicity, avoiding dehydration, And if he has loose stools and other things, dehydration, what he has to do, like when he has to meet the GP and when he has to meet the nephro, those things should be in the advice. Okay. Any doubts with this scenario? Read the chat box. Antispasmodics. Infertility is not that much common in HSP, but yes, arthritis is a common in male child. Antispasmodic supportive measures, yes, you can give. Steroids, yes, indicated for abdomen pain, okay, after stabilizing vitals. Throat swab in the investigations, yes, you can do it, considering there was an prodrome previously, but yes, you can include it as a part of completion. In HSP, can we find history of rash and joint pain for 1 year? No, that was a past history. So he had a past history of rash and joint pain, managed with no PD, it is 1 year back. But we could have a recurrence. It doesn't last for 1 year, okay? Yes, other differences are abdomen pain, intussusception, HUS, yes, we have discussed torsion testis, DKA, yes. You should definitely ask about the polyuria, other things. Yes, DKA is a good differential. HSP, malignancy, meningococcemia, fever, other vasculitis, ITP. Yes, we have discussed these things. Okay. Any doubts? Okay, no further doubts, you can close the session for today. Yes, thank you all.
Thank you, sir.
Thank you, sir.
Okay, bye.
Thank you.
Thank you, sir. Thank you.
Thank you.
Thank you. Good night.
Thank you, sir.
Good night. Bye.